This week, we're talking about rice for injury, rest, ice, compression, and elevation. Is that still the best way to deal with an acute injury? This is a decades old go to strategy. Does it even work? We've all done it. A systematic review tells us there's not enough evidence for rice to apply it in all acute ankle sprains. In fact, there's a newer study of low back pain that might indicate that allowing the body's natural inflammatory response to go unhindered could even be the key to avoiding chronic pain from that injury. Even more, this study also talks about the use of anti-inflammatory drugs being associated with a potential increased risk of persistent pain. This is a huge change from that rice model. And it's one that could mean that our parents' advice to walk it off might have been great, even if they weren't sure why. So just don't tell them, because I hate when they're right.